The American Lung Association is excited to have you joining today to hear about our new and enhanced asthma resources, as well as gain knowledge about the importance of stock asthma medication in schools, understanding stock asthma medication laws, and effective strategies for implementing from Texas school nurses who have been successful. I'd like to first introduce Cindy Trubisky, Senior Director of Nationwide Asthma Programs with the American Lung Association. She'll be sharing all the exciting highlights from the American Lung Association during Asthma Awareness Month. Go ahead, Cindy.
Great, thanks, Emily, and welcome to you all today. So before we get into the Asthma Awareness Month highlights and opportunities, I want to go over today's learning objectives. So today we'll be discussing a few topics, and by the end of the presentation, you'll leave with knowing about new and enhancing asthma education resources and programs from the American Lung Association, understanding the importance and benefits of implementing stock asthma medication programs in schools, knowing how to interpret the stock asthma medication laws, what school personnel need to know, and which components need to be applied and how. And then finally, you'll learn how to find the tools and guidance for navigating stock asthma medication implementation, barriers to apply to your journey. So while we're dedicated to asthma resources and programming all year long, we take an additional focus during May because it's Asthma Awareness Month. So this year we're focusing on increasing awareness about asthma topics, including indoor air quality, stock asthma medication in schools, and parent resources. So everything we discuss in the next couple slides will be linked to the chat or the Q&A box and can be found on our Asthma Awareness Month landing page at lung.org/asthma-awareness. So this Asthma Awareness Month, the American Lung Association is asking everybody to join us in advocating for critical legislation that will improve air quality and services for people with asthma. So here are two of this year's most critical legislation actions. So first, it's to save the CDC National Asthma Control Program that was eliminated in the recent budget cuts, and to protect Medicaid and Children's Health Insurance Program, also known as CHIP. And a large portion of children, nearly half of them, benefit from the good care of these programs. In addition, the Lung Association is advocating to protect staff and funding for the incredibly important asthma work done by the CDC and the National Institute of Health. So you can find these petitions to sign, to urge Congress, or make calls to protect these programs on the landing page that's shared in the Q&A. Okay, now on to learning opportunities for professionals and parents alike. So whether you're a healthcare professional, asthma educator, teacher, staff, or patient advocate, it's really important to stay informed about asthma care, the resources, and support options. The Lung Association offers comprehensive educational programs and resources that are proven effective to help healthcare providers, adults living with asthma, and their caretakers, and the parents to better understand asthma and improve asthma management and overall quality of life. So here we're highlighting 3 this year for Asthma Awareness Month. First is our Asthma Basics course. It's a great way to learn about asthma, managing triggers, the value of an asthma action plan, and how to respond to breathing emergencies. So this course is available in English and Spanish, and it's a great resource for patients and caregivers all the way to healthcare professionals. It's an online course. So secondly, our new professional spotlights are a series of newest courses to help healthcare professionals maintain their knowledge of asthma diagnosis and treatment, and increase their understanding of applying the asthma management guidelines. So these are free courses that are short, 15 minutes or less. They're bite-sized learning opportunities to keep providers up to date on their professional development for asthma. And then finally, all adults can support their own asthma education and management through the American Lung Association's proven signature program called Breathe Well, Live Well. The program is available in English and Spanish, and it's accessible by a traditional group setting in the community near you. It's telephonic and video call based, and now online. Lots of good options there. And on to asthma and youth. We have recently updated education and resources for parents and caregivers of children with asthma, as well as for children ages 5 to 7. So this is exciting. The Parents of Children Living with Asthma page on lung.org provides information on diagnosis, treatment, and unique health considerations while caring for a child with asthma. We have also provided 8 conversations to have that are important to my child's asthma care. This is a new conversation guide just for parents to assist them in managing their child's asthma. And then lastly, as an exciting new resource ideal for children with asthma and without at ages 5 to 7 is called Asthma Superstars. This spotlight program is a fun, engaging, interactive online storybook that also includes an activity guide with downloadable coloring sheets and activities for kids. So that's fun. Okay, 2 more items of note for parents and caregivers. So we offer education and support resources for parents and caregivers. Here are 2 examples that I'd like to share with you today. So the first is Patient and Caregiver Network. That's a nationwide online support program providing direct access to lung disease management tools, education, and connections to other patients and caregivers. That's the important piece. So you can find free resources such as a wellness hub, disease-specific online communities, on-demand webcasts, live webcasts, and lung disease management tools. And secondly, our lung health navigators are our best kept secret, and now they're yours. Our health experts who provide free, customized one-on-one asthma or COPD education and support for individuals and their loved ones facing lung disease. So it's delivered by telephone or video call. They're registered nurses, respiratory therapists, and certified tobacco treatment specialists and certified asthma educators. They're committed to supporting your every step of health journey, whether it's one question or the whole journey. So you can connect with our lung health navigators by phone or email. It's easy. Okay, finally, before we get into our main topic for today, we highlight during Asthma Awareness Month the importance of indoor air quality in schools, as I mentioned. So poor indoor air quality can have a negative impact on health, especially for children and those living with asthma. School-aged children spend about half their waking hours in school, so it's important that schools have plans in place to ensure good indoor air quality and healthy learning environments. So starting on July 1, coming soon to you, all schools nationwide can enroll in the new Clean Air School Challenge. This new program is an opportunity for engagement, recognition, and technical assistance aimed to empower schools, K-12, across the country to address indoor air quality. Participating schools have access to those resources, peer mentorships, and they can apply for mini grants too. So you can learn more about and download the materials that go with our Clean Air School Challenge, including a new case study about one small school district and their experiences and successes assessing indoor air quality by visiting our website, lung.org/CASC, which is Clean Air School Challenge. So I'm going to recap real quick, and then we'll get on to the next part of our program. There are 5 things that you can remember to do during Asthma Awareness Month this year. So the first is take an asthma education course so you know what it's all about, such as the Asthma Basics online course, English or Spanish, and the Breathe Well, Live Well Plus online program for adults, English or Spanish. 2, visit our newly updated For Parents of Children with Asthma page for those great tools and that conversation guide for parents of children with asthma. 3, Learn more about asthma and the effects of indoor air quality in schools at the Clean Air School Challenge website I mentioned, and consider joining this challenge starting after July 1st. 4 is contact your congressional representatives today because we really need your voice and help protect the critical programs that I mentioned for people living with asthma in the US. And 5, support asthma research by donating to the American Lung Association so we can continue our good work. So you can find all these opportunities at that Asthma Awareness Month landing page I mentioned at lung.org/asthma-awareness. So that's the overview I have for today. Thanks again for your time to share this year's focus on Asthma Awareness Month. I hope you found it useful. Reminder, you can also find this information in the chat and all the resources that we have. So now I'm going to turn the presentation back over to Emily to introduce our keynote speakers for today. Thanks so much.
Thanks, Cindy. You highlighted a lot of really great asthma education resources for everyone. We appreciate it. Again, if you have any questions about the resources that Cindy just shared, please ask them in the Q&A feature and we'll answer them throughout today's presentation. You can also find the link that was mentioned in the Q&A. We are now going to discuss stock asthma medication implementation strategies and hear from a few Texas healthcare professionals. We'll learn about the legislation and what school personnel need to know to implement, as well as hear from 2 Texas school nurses who have been successful in bringing stock asthma medication to their schools. Before we hear from our guests, I want to quickly review the many benefits of stock medication in schools. Having stock asthma medication available in schools helps avoid unnecessary respiratory distress, prevents death, provides a safety net for children who forget their medication or just don't have access so they can be able to stay in class. It allows for pre-treating before exercise, de-escalates asthma episodes to improve overall health, can help lead to a faster and more accurate asthma diagnosis for children who respond well to quick relief medication. And finally, it can help open communication between schools, families, and healthcare teams, enhancing overall asthma management. Looking at the law a little bit more, all 50 states and the District of Columbia have passed a law allowing students to carry and use inhalers at school. However, implementation of these laws has some variability. And as you can see from this map here, currently 24 states have laws or state administrative guidelines allowing schools to stock quick relief medication. Many laws allow for anyone experiencing respiratory distress to receive stock asthma medication, but most of the laws are voluntary and not mandatory. Now we'll hear from an asthma professional who's well experienced in developing, understanding, and interpreting stock asthma medication legislation and advocating for implementation in schools across Texas. Leslie Alsop is an assistant professor of pediatric and women's health, affiliate faculty of the Health Policy Center, and fellow of the Institute for Health Disparities at the University of North Texas Health Science Center. She's also principal investigator and faculty partner for Asthma 411 at Safer Care Texas and a certified asthma educator. For the past 12 years, she has been involved with the adaptation, piloting, and sustainment of the Asthma 411 model in Texas, which provides unassigned albuterol in a framework of best practice in school asthma services through community partnerships. Since 2019, she's been active in state-level asthma initiatives, including the passage and implementation of unassigned albuterol policy and the Texas Asthma Control Collaboration. As a reminder, before Leslie gets started, please submit any questions for her in our Q&A feature. Go ahead, Leslie.
All right. Thank you so much. Thank you for making this event possible and for sharing and creating those fabulous resources that were just introduced to us. When I think about the implementation of stock asthma medications, I think it's really helpful to consider different levels of implementation because the strategies, tools, and resources are really different that are needed. Single individuals may be active at each of these levels, but the tools can be very specific, especially if we want to make sure that our stock medication are improving safety and improving asthma outcomes. I often shorten that to saving and changing lives, which I think is such a fantastic work. And it's only accomplished through our partnerships and really so many people working together to move this forward. At the national level, we have our professional and advocacy associations and individual researchers. I'm just going to say a word of thanks to them today, folks like American Lung Association and those you've heard of, as well as National Association for School Nurses, American Thoracic Society, and others, and some of our terrific national leaders like Drs. Gerald, Lowe, Vollerman, and Papalargo. At the state level, this is where we have an opportunity to create policy. And I think it's also an incredibly important place to take those nationally developed resources and insights and get them working for the unique legislative and educational environments that we have in each of our states. I kind of think of it like the national tools may be a platform. At the state level, we can start building some wheels that are going to work in our specific terrain. Community partners is where I spend an awful lot of my work and time, and I think this is one that's important and can do with a lot more attention than it sometimes gets, because we're often working in that community with the same children, the same families, same goals that we share. We really need to be working together, and it can make a world of difference to bring in the resources from those community partners so they're standing behind the delivery of the asthma services that happen at school. And school health, both district, campus, and multi-level in itself, I put it last here, really, it's at the forefront. And I think of so many people working in this space as doing the hero work. They're the ones with their hands on the lever that can make that difference with saving and changing lives. I always feel I learn more from our school nurses and health service administrators than almost anyone else I talk to. And I'm so thrilled that we'll be hearing from Kelly and Wendy, and can't wait to hear their perspectives. So when we think about the policy level at the state, a couple of things here to point out. First of all, this line with arrows in two directions. I selected that because your policy is really a journey rather than a single event that's one and done. And I've got some of our landmark dates. I'm going to say a couple of highlights, and I hope helpful takeaways from each one. The first point that I'd like to make is what happened before 2019 when we first had policy, that pre-policy stage. Unassigned albuterol doesn't necessarily start when policy is passed. That was true in Texas, and I'm going to guess it's true in a lot of other states. Our group have been working with community partnership initiatives for about 6 years. And when we started working with school nurses, we found some of them have been doing unassigned albuterol for 10 years or more before policy was passed. What's critical about this? Two takeaways I'd like to share. One, if you're sitting in that place, district or school campus, maybe an athletic program or a community partnership doing unassigned albuterol, you may wonder, why should I be worried about the policy? My program's working just fine, and we have what we need. The problem is you don't know when that policy may be changing or put in place. You need to be a part of that discussion to make sure that the policy is supporting all of the good work you do. On the other side, for the folks who are considering the policy, it's important that you reach out and have the best sense you can of what's already happening across your state. Those individuals may have critical data and experience that will strengthen your initiative, work for success, and help make sure you're not going to be doing policy revisions the next time the legislation meets. So 2019 is when we passed our first legislation in Texas. Always a great first step, but I think we're not the only ones who have found it's just step one. We did tag this to our epinephrine laws, which were already in place and people were familiar with them. And that is a great strategy to consider if you're getting started with that policy effort. However, we did know that there were problems almost as soon as we got that passed. One last point before I move on and get to the 21. There were two lines of advice that I was receiving from people. Once we realized policy was in place, that's great, but there was going to be some issues. The first, people said, don't worry about the policy. It's too much work. It's too hard. It's too uncertain. Just focus on finding a way around it. The second line of advice I got was, we can do it and it's worth it. I urge you to take that last one. It got us here to 2021 with our first attempt at revising. Important point to take away. If you're new to policy, you might be discouraged when you don't get it the first time. Don't be. Those who are seasoned in policy realize it's going to often take more than one effort. Another really, really important point is national guidelines were issued. Individual researchers, national associations like National Association of School Nurses and ALA endorsing them. They are a great resource. They'll be on one of my upcoming slides. And if you aren't familiar with them, I highly recommend them. 23, we were able to get the legislation passed that aligned our policy with best practice guidelines. I won't say too much about that process. I have a whole slide on that, but 100% worth it. Just remember, it's not the end point. It's just the beginning. And we are now with 2025. Implementation is ongoing. We are still working on this collaboration. We are still working to try to tailor those national best practices into our state. We have our administrative code has just been finalized, and we're working on some of the rules for implementation and training. Last point before I go on, I do want to emphasize that so much of what we're able to do collaboratively, which comes up again and again and again, has been supported by our Texas Asthma Control Program. And that gets back to the earlier point. We need our national asthma control programs. They are so important all the way down to each one of our children and families we're trying to support. Okay, my next slide. So what were some of our key points that we wanted to work with in 2023, things that we were initially missing and that are in national guidelines? First of all, who may administer? We want nurses on every single campus, every single hour of the day, but we know that is not the reality that we're faced with. And I'm really grateful to all of those, especially the National Association of School Nurses, who put their weight behind saying anybody who is trained and authorized should be legally permitted to provide assistance in a breathing emergency. Who can receive albuterol at school, this stock medication? Any person reasonably thought to be experiencing respiratory distress. This was critical. Initially, our laws had said a person with asthma or a child with asthma, they had to have written documentation at school. We know that there may be first-time asthma events that happen at school where they don't have medication. And so many kiddos or parents who haven't been able to communicate that, or the information isn't readily available when the emergency occurs. If someone can't breathe, as ALA would say, nothing else matters, and you've got to be able to provide the assistance. Where can it be administered? Well, on a public, private, or charter school campus, but a key we wanted to be added was that it could also be added at a school event if the school district chose to make that their policy. This may be especially important for some of our smaller rural schools where in Texas it can be very long waits for EMS calls. You can be on the road for a very long time in between taking a busload of kiddos or a shuttle full of kiddos to an athletic event. If the school district feels they need to bring that respiratory medication with them, they ought to have that option. And last of all, when do you need the trained personnel? In Texas, they should have those. They're required to have them during regular school hours, 30 minutes before and after the bell. After-hour events are an option, but they're permitted if the school district feels it's important. So next slide. A little closer look at our asthma efforts there. Again, the national guidelines were critical for us. We formed an interdisciplinary task force that took time. We basically just reached out, snowball method you might call, who knew who, and pulled them together. We had this group meeting once a month at least for 18 months. Now that may seem like a lot, but I will also point out that's a total of 18 meetings. Some of us may feel like we have 18 meetings in a week or less. It is definitely worth it. And it was really important both to establish that collaboration, a consensus, and build our communication tools. This is the types of groups that we had. And again, we've got a poster on this process, and very importantly, the second reference here is, again, the national guidelines, which have so much important information on getting this successfully accomplished. So what's our next step? One thing I'll say, all of those 18 months that we're putting together our collaboration, building relationships and trust, they're not to be put on the shelf once your policy is passed. Those are great resources you build up, and those collaborations can be critical as you move toward implementation, making sure that you continue to have multidisciplinary and multiple domains involved in your implementation. Our national and state asthma control programs, again, can't say how important I believe they are and how important they've been to the successes that we have. Tailoring those national guidelines to state needs, it can take time. Make sure you're getting as much feedback as possible. That's the process that we are in right now. And data is key. Evaluation at every level is at the foundation of sustaining these efforts for safety and asthma outcomes. I think as we talk about a little bit more, I'll be saying more of data. I'll try to restrain myself. I could get so excited about data sharing to improve asthma outcomes. All right. So I mentioned that the place that I do much of my work is in this idea of cross-sector partnerships. And what is that relationship potentially to unassigned and stocked asthma medications? Well, I think it's a really important one. Again, those folks in a community are going to share goals and are working often with the same kids and families. When you can engage your community partners, you are bringing in potentially not only a whole new domain of expertise, but a whole new domain of resources, which I'll talk a lot more about. This is not a new idea. The model here that I'm based on is the Asthma 411 model. And that was first developed over 20 years ago in St. Louis, Missouri, as part of controlling asthma in American cities. We began piloting it in Texas in 2013. That's where I began working on the initiative. And it has been a sustainable approach that continues to expand to support our efforts to improve asthma outcomes. So what has that looked like today? What are some of those benefits of our cross-sector partnerships in action? I've just taken a couple of snippets from our program evaluation in 23-24, and I'll take a little bit of time to talk about those and highlight what some of those options are. First of all, Through data sharing across our consortium in the greater Tarrant area, we know there were 1,476 reported uses of unassigned or stocked asthma medications, albuterol, in the 23-24 school year. We have 353 campuses currently in that partnership, 10 school districts, total of 250,000 enrolled students. And we formed this consortium, got it rolling off the ground in 2017 after a very successful pilot in 2013 to 2015. The mean age of those kiddos, 10 years of age. And as we look across our entire consortium, the average number of uses per campus is just over 4 uses of the stock medication in a school year, but it varies a lot in each district. Some were only using it about twice. Some had an average of 2 uses per campus over the school year. Others almost had 10. So while this overall number is really important, it's also important that you can break it down, drill down, and see how this is being used across diverse districts. That is what's going to allow you to be able to see what resources are needed where. A last point on this, because we can aggregate the data in this way, we can share it so that it supports the resources in the consortium, but it protects some of those sensitive issues that may come up in a school district. School districts want to know the good work they're doing, but they don't necessarily want to point out which campuses and which districts have got these very high levels of use or high levels of asthma needs. This kind of data sharing allows both needs to be met. The folks that make up our consortium in the greater Tarrant area, UNT Health Science Center in Safer Care, Texas, Cook Children's. This is our nonprofit health system, and they work to provide all of the medications, all of the supplies, do all of the delivery and pharmacy work free of charge to our school districts. The JPS and Acclaim side, these are the folks that lead the medical advisement. We have a medical advisory council of 6 pediatricians that both reviews medically the standing delegation orders and outcomes annually and meets regularly through the year. So how did it work out for kiddos? After the standing delegation order use, not all data is perfect. We know that. We got it back for 1,465 of the 1,476 cases. We had a deposition for them. So about 3/4 of the kiddos were able to complete the school day. Fewer than 1% required a 911 call. We can also translate that into the benefits educationally. Over 4,000 reclaimed instructional hours across the consortium. Now, again, knowing what's happening at a consortium level isn't enough for our school districts. We then, thank you, we need to break that down so we can get that information to school districts, and they can take it and advocate for their health services. And they can know, they already know those high use campuses, but it's a shared mental model that we can all have, protecting the privacy where it needs to be protected, but trying to get the resources where they need to go. The last point I want to make on this in our outcomes is that we do an annual nursing survey, and health staff. It goes out. We have about an 80% response rate, and we've had that every year since 2018. We have always ended up with a satisfaction, satisfied or very satisfied, in the high 90s. It's never gone below that. I think that's really important because so often nurses, or we'll hear people say, we can't do it in our district. Nurses don't want to take on one more thing. They can't do it. They're already overwhelmed. Well, they are overwhelmed, but we're bringing them new tools to solve the problems that they have. And the overwhelming majority of those nurses are happy with it and really glad when they have it done. We stand around 85% at very satisfied, and most of the balance, another 14% or so, at somewhat or satisfied. We also don't have it listed here, but overwhelmingly, parents are happy with the program too. That's another concern some folks have, is that parents are going to be upset if somebody's helped their kids. We have not seen that. And again, we've been starting this in 2013. So that is everything for me, I believe. And I look forward to hearing any questions. I will point out we have our website linked here, Asthma 411. And of course, we're really happy if anyone wants to reach out additionally as well.
Thanks so much, Leslie. We don't have any questions right now, but just a reminder, if you do have questions for Leslie, to enter them in the Q&A. We can get to those throughout the rest of the presentation and at the end. That was a really great overview of your navigation through the stock medication legislation journey, and I think it probably really helped everyone. Thanks. All right, we will now hear from two Texas school nurses who have been successful in finding unique solutions to overcome barriers and implement stock asthma medication programs in their schools. Wendy Hine is a nationally certified school nurse and seasoned healthcare professional with over 2 decades of experience in direct care, nursing leadership, education, and health services management across hospital, skilled nursing, and school settings. She currently serves as Director of Health Services and District Lead Nurse for Midlothian ISD, where she oversees district-wide health protocols, staff training, compliance reporting, and student health initiatives. Wendy earned her BSN from the University of Texas at Arlington in 2024 and is also currently enrolled in an MSN program. Her credentials include BLS CPR instructor certification and active Texas RN licensure. She's a nationally certified school nurse and is working toward her professional legal nurse consultant certification. She's a National Association of School Nurses, NAA, as well as the American Nurses Association. Recognized as Midlothian ISD's Professional Employee of the Year in 2023, Wendy is presented at healthcare conferences, led mission teams, and received the Florence Nightingale Award. She's passionate about promoting student wellness, supporting nursing teams, and advancing health education within her community. We've also got Kelly Brooks, who's an experienced school nurse who has been serving school-age children for 31 years. She has been with Comal ISD for 20 years and currently serves as Director of Health Services. She advanced to the administrative level in 2019 and supports school nurses across her district. Kelly holds a BSN, active Texas RN licensure, and is a nationally certified school nurse. Kelly is dedicated to serving students, parents, and the community with compassion and professionalism. She's also a mom of 4 and grandma of 1. Go ahead, ladies.
Good afternoon. My name is Wendy, and it's so nice for everyone to join us today. I think this is such an important topic. And as Emily kindly mentioned earlier, I was part of that process for implementing some of these procedures within our school district here in Texas, as well as Kelly, who will also be going over some of these slides, as she's done something similar for her school district. So we're going to kind of split up the slides and just discuss some of this. But again, if you have any questions, feel free to put it in the Q&A for us. But one of the common things that we want to go over is finding those solutions to implementing some of these things that we were talking about. So we're taking it from a policy and the legal stature, and then you're going to try to take it and implement it within your school district. And so one of the most common questions that I get asked when talking to other school districts is about finding a medical director to sign off on some of those standing orders. So, you know, we want to really try to inhibit any of those barriers you might come across. So just some ideas that we have that could help you with that is maybe sharing medical director with another school district. So if you don't have a medical director for your own district, reach out to some of the other communities surrounding you and see if there is a possibility in sharing. Also, if you have a collaboration with a local hospital or doctor or any of your county health departments, you can reach out to them as well. I know for our school district, we have a local pediatrician that works with a hospital system nearby that volunteers each year to be our medical director. And it's just a great collaboration. And he's open and willing to work with us and collaborate with us on some of these new initiatives that we bring to him. Another option when talking about trying to find a medical director is to see if your state offers a list of providers that are willing to write those standing orders. I know for Texas, if you go on Texas's Department of Health website, they do have a series of linked providers that you can find, a list of all these physicians and their contact information so that you can reach out to them to get that medical advice and direction from them. And they're more than willing. So that's it on my slide. Kelly, you want to take the next one?
Yes, thank you. It's really great to be here to discuss our implementation of this great being able to use albuterol for respiratory distress across the districts. The other thing, you really do need to have that medical director, somebody that's going to be able to write that order for you. But, once you know that policy is in with your board policy, the next thing you do need to consider is the cost. So like it's been mentioned a couple times, finding a community champion, possibly a local hospital or a health department that could possibly help out with that cost of it. I know for like our district, we are 590 square miles. So we fall under a couple different health departments. And so it's been kind of difficult with that. So we just placed it into our budget. You can check with local pharmacies, make sure that you are getting prices from different, like I said, different grocery stores, pharmacies. There are even some online places that you can get it, like School Health Supply. And then just be able to make your case in implementing this. It will reduce EMS calls. And of course, everybody wants the kids in class in their seats learning. So by utilizing this albuterol and being able to administer it for any respiratory distress, that's going to keep them in their seats longer. And then another way is possibly fundraising. That's not something that we've done in the past, but it is absolutely something that you could do if funds are low and you don't have that availability. Look at ways with your business office on being able to fundraise. I know, finances right now are kind of questionable with our Texas school districts, but we have been very lucky. We've been implementing this program for quite a while, but just, kind of with your next budget talks, knowing how much it'll cost, add that to your budget so that you're aware of how much it'll cost and it'll fit into that budget. And then supply, again, consider your larger pharmacies. Walmart, we have HEB. I know the first few years we had ordered our albuterol through HEB and they were one of the cheapest. Over the past couple years though, they've kind of shied away. They've been more expensive. They're not willing to accept a prescription that says X amount of inhalers for the school district. So this past year we have moved to School Health. Also an option is working with your local EMS service for that supply. Again, existing partnerships, maybe check with some of through your HR department, who your insurance is with. Maybe some of those pharmacies will be willing to help you out with that. And then a really important thing when you're ordering yours is to make sure you have the longest expiration dates, up to 18 months. One of our first times I went and picked up some albuterol, 35 doses of albuterol or albuterol inhalers, and it was set to expire in 6 months. And so, of course, I had to refuse that because I'm not going to spend that money for a 6-month amount. Okay, next slide. Wendy?
Great, thanks, Kelly. So another part of this implementation strategy for your district is getting that buy-in. And so this is something else we hear from other school districts and the nurses that are really wanting to champion this. And so for us and for my personal experience, I think being prepared with answers to talk to your administration, your school board, or your medical director ahead of time. So essentially figure out what that process is going to look out, have it laid out, to limit the back and forth that can go from it. So you want to explain to them the why behind why we're wanting to do this, the how this is going to take place and what it will look like in your school, and what support or approvals that you'll need. So answering those questions and working through the why, the how, and the what ahead of time, and bringing a complete package to whoever you're bringing this to, whether it's your board or your administration or your medical director, is really going to help the back and forth, and it's really going to be perceived with a lot more enthusiasm. Next slide, please. So talking through that process, and part of that buy-in is getting everything together and utilizing a great checklist assessment to determine when we're going to administer this albuterol, and determine who's going to be trained to administer. So this is a lot of that part of preparing ahead of time to bring with your buy-in. And for a lot of these resources, like we discussed earlier, we use for our school district, we really relied on the information provided by NASN. Asthma 411 has a lot of these forms already in place. So if you're looking for what does a standing order look like, you can go there and there's resources for that. What does a good checklist assessment look like? So you can, there's resources out there that will really take, and you're not having to reinvent the wheel that's already been provided. So you can really take a lot of these resources and make them fit for your school district. And it really makes the process a lot easier than trying to develop something all on your own and create all these items that are already out there and available for you. And that's just something we do with our school district. When we decided, okay, we want to make sure, even though we have a nurse at every campus, we have trained professionals at each campus that are not licensed medical staff, but we have trainings, we have skill checkoffs for them, we have an assessment. So even if the nurse is not there, we're making sure that this care is provided to all students at all times that school's in session. Next slide.
Okay, and so for utilization, when and how often? Midlothian ISD implemented their program in the 23-24 school year and utilized stock asthma medication 11 times 23-24 school year and 6 times in the 24-25 school year. Now they are, Wendy, if I'm correct, you guys are doing the nebulizer, correct?
Yes, that's correct. For our school district, we started using the nebulizers. We were able to secure, we kind of like what Kelly was talking about. We were able to fund that. We went and we reached out to our local fire department, and they had a contract with Boundtree Medical. And so we're able to get a box of 40 to 50 individually wrapped nebulizer treatment doses for like $8 to $10, which is phenomenal. And so that's what we've been utilizing.
So we, Kamala ISD implemented our program in the 2020-21 school year. So we've been using this process quite a while. This year alone, we have administered 40 doses. Our student enrollment is right at about 29,000. Of course, we have also used it for district employees as well. The majority of the doses are being given to our elementary campuses. So when Wendy mentioned Boundtree, we are not doing the nebulizers. In fact, we still aren't doing any nebulizers on our campus. So we are doing the metered dose inhaler. And through Boundtree, I don't know if you can see this, we ordered disposable spacers to utilize with those inhalers so that we can use it for the student, throw it away, and clean the inhaler. And then just kind of going backwards to the assessment. So we do have, like they said, a respiratory assessment checklist that the nurses will, or trained unlicensed professional will utilize in the event of somebody going through respiratory distress. It's a checklist like vital signs, respiratory rate, their symptoms, coughing, are they wheezing, things like that. And then there's kind of like a thing for them to calculate the score and determine what their next steps are. Are they going to monitor? Are they administering the albuterol? Are they calling the parent? Things like that. And then once they complete that, they're notifying me at district office and sending me that form because then we do report that to DSHS online.
Thank you both so much.
Yeah, I think that's it for us.
Yeah, we just had one question, and I think you both actually answered it about the specific, medication that you're using. It was just if you're purchasing disposable single-use inhalers or MDIs. And Kelly, I think you just hit that. So thank you both. Again, if anyone has any questions for Wendy and Kelly, feel free to add them in the Q&A now, and we will get to them before we wrap up or after the presentation's over in a follow-up. We just heard a lot of valuable real-life suggestions that hopefully can help other schools achieve the success that Wendy and Kelly have seen over the last couple of years. That was a really great add in there. I'll now turn it back to Cindy to share more stock medication resources from the American Lung Association. Go ahead, Cindy.
All right, thanks, Emily. And oh my gosh, thank you, Kelly and Wendy. So beyond these amazing solutions, they hit them all. They have provided us tips and tricks from the field that have been successful. I want to share today with you the American Lung Association. We offer 5 stock asthma medication implementation guides that are focused on most of these key areas of successful implementation. So not just specific to the Texas area, but much larger and customizable to you. So they are funding, obtaining medications and supplies, training personnel, raising awareness among stakeholders, and managing data collection and reporting. So you see the theme here. So similar to the discussion with our speakers today, these guides were built by a group of asthma management in schools experts over the past 18 months to 2 years to address key challenges and provide strategic solutions for schools looking to implement and enhance their programs. So always learning and growing as they go forward. So it's a good starting point, and it can be tailored to meet your school's needs where you're at. And it'll also ensure your compliance with your state and your local regulations. As you see, there's a lot of moving parts. So today you've heard a ton about asthma education, resources, and the importance of stock asthma medications. I'd like to close with a reminder of the American Lung Association education and self-management programs for youth that I mentioned at the beginning, our free asthma basics course, and the 2 self-management education programs for youth, Open Airways for Schools, is a program created for children 8 to 11. Trained facilitators, which you can all be one, help children take steps to prevent asthma symptoms, recognize their symptoms of asthma when they first occur, and carry out appropriate management skills. So putting the responsibility back in the hands of the children for their self-management education. Then they discuss and solve asthma-related problems with their parents, medical professionals, teachers, friends, and feel more confident about taking care of their asthma every single day. Kicking Asthma is a version of the program for older children, ages 11 to 16 years old, that empowers them through fun and interactive approach to self-management education. So Kicking Asthma includes, think about middle schoolers and the adolescents, but includes different learning techniques suitable for teens and highlights self-management practices such as recognizing their triggers, talking to friends, and proper medication use. Okay, so that concludes our discussion today. So thank you so much for participating. And thank you so much to our amazing presenters today from the American Lung Association. We are so happy to have you here.
Thanks, Cindy. We've got a couple more minutes, and we've seen a couple more questions come in. They are going to be best for Wendy and Kelly, so I'd like to have them come back and answer these in the last couple minutes. Someone asked, Wendy, this would be for you. Do you have a training on cleaning the nebulizer for all staff and volunteers to use?
So yes, we have set up. We have all kinds of fun things set up to handle this. But yes, so anytime a nebulizer is used, the nurses have a disposable use tubing, mouthpieces, and equipment to attach to the nebulizer. So yeah, there's a whole training checklist that goes into that and covers how we're going to utilize those nebulizers for those emergencies.
Great, thanks. And Kelly, I know you already answered this in the Q&A, but just so everyone else can hear, are you administering only to students who are diagnosed with asthma or to any student who is symptomatic?
So it is anybody experiencing respiratory distress. Again, we'll follow that checklist that we have provided to all the nurses and trained backup staff. And so they'll follow that guideline. So if they're experiencing it, it doesn't matter if they have that diagnosis or not. We do have, this is a good point too, on that 411 Asthma 411 website. There's a lot of resources, and we actually developed a referral sheet to send out to any students that are coming in with respiratory distress that do not have that diagnosis and received albuterol. We send that home with a parent to let them know that they need to be followed up by their medical provider.
Great. That leads right into the next question. Are you getting a broad parental consent to treat at the beginning of the school year or contacting parents at the time of need for verbal consent to treat?
I think, sorry, Kelly.
You go.
We do send out a broad notification to parents at the start of the school year. Obviously, in the event where we're looking at as someone that is in respiratory distress, we will make every effort to reach out to that parent and collaborate with them before we're administering that medication. But in the event we're unable to reach them, which sometimes happens, we're giving the medication based off the prior broad authorization that went out to parents at the beginning of the year.
And then one more. Does your policy also cover staff and other adults at the school site or events?
So I had it pulled up, my board policy, but I don't think it have, it's really anyone during the school day. So we don't send it like to after school events. We don't send it to athletic events. It's throughout the school day for anyone on that campus.
Great, thank you. All right, well, I'll echo what Cindy said, and we greatly appreciate all of our presenters and everyone for joining today. We hope you learned a lot, and thank you.